Yeah, warm greetings to everyone. In this video, we are going to discuss rehabilitation team members and their roles and responsibilities. So, rehabilitation is a continuous process where a team of doctors, nurses, therapists, and various other medical professionals is formed to help the patient recover from his present state of illness to a normal state of health. The rehabilitation team is formed based on the illness of the patient. For example, the doctors, nurses, and therapists in a drug rehabilitation team will be different from those in an accident rehabilitation team. Each member of the team with his or her individual expertise has a different approach in healing the patient. Various needs of the client decide which therapist will be a part of the rehabilitation team. Some of these needs are the client's illness, duration of illness, severity of the same, and financial capability of the client and his insurance coverage. So this is the general introduction about the rehabilitation team. Now we will see meaning of rehabilitation team. A rehabilitation team is a group of healthcare professionals from different specialties who work together to assess patient needs, develop a rehabilitation plan, provide coordinated treatment, monitor progress, promote functional independence, facilitate social and vocational reintegration. So this is the meaning of rehabilitation team. So next we will see types of rehabilitation team approach. Rehabilitation is a coordinated process that helps a patient regain physical, psychological and social functioning after illness or injury. Based on how healthcare professionals work together, rehabilitation teams are classified into three types, that are multidisciplinary team, interdisciplinary team and transdisciplinary team. So first one, multidisciplinary team. So a multidisciplinary team consists of professionals from different specialties who work with the same patient but independently. Each professional assesses, plans and treats the patient separately. Okay, so key characteristics for this multidisciplinary team: separate assessments and treatment plans, and they provide limited communication between team members, and each member works within their own discipline, usually led by a physician. So second one, interdisciplinary team. An interdisciplinary team consists of professionals from different disciplines who work collaboratively with shared goals for the patient. So they discuss the patient condition together and create a common treatment plan. So characteristics of the interdisciplinary team: they have the shared goals and joint treatment planning, regular team meetings, open communication and patient-centered approach. So third one, transdisciplinary team. A transdisciplinary team goes on step further than interdisciplinary. In this model, professionals share roles and responsibilities. One primary provider may deliver multiple aspects of care after receiving input from other team members. These are the three types of rehabilitation team. Now we will discuss core members of rehabilitation team. Usually a rehabilitation team comprises of the following members. One is the medical team member, another one is socio-vocational team members. So medical team consists of following members, that are physiatrist. Here physiatrist is the team leader of the entire rehabilitation team, and occupational therapist, physiotherapist, speech therapist, prosthetist, and also rehabilitation nurse, biomedical engineer, also equipment manufacturing company, orthotist, also specialist in orthopedics, neurology and other specialties. These members are considered into the medical team. So also we have the another team that called as socio-vocational team. It consists of architect, special instructor, clinical psychologist, placement officer, social worker, vocational evaluator and counselor, recreation therapist, government voluntary agencies and skilled instructors. So these many peoples are called as core member of the rehabilitation team. Okay, now we will see one by one each person's roles and responsibilities in during rehabilitation therapy. First one, physiatrist. The physiatrist is the leader of the rehabilitation team. He assesses the patient carefully and monitors the patient's progress. He decides what all medical services the patient needs and then design the program as per the patient's need. He will design a patient-oriented treatment program based on which the other members of the team will be decided. His specialization is physical medicine and rehabilitation. So next one, physiotherapist. After a traumatic brain injury, a person may suffer from musculoskeletal or neuromuscular issues. This injury affects his daily activities. The work of a physical rehabilitation therapist is to work on improving this problem of the patient. He will focus on the development of posture, strength, physical independence, quality movement, balance coordination and other sensory motor activities. These are the main role of the physiotherapist in rehabilitation team. So next, occupational therapist. The work of an occupational therapist is to make a patient learn advanced independent skills that will help him in various ways in the personal life. The patient will be taught cooking, shopping and banking by an occupational therapist. Occupational therapist helps patient to perform activities of daily living. So next, speech and language therapist. A person suffering from any sort of brain injury may face difficulty in talking clearly. Therefore, it becomes difficulty for the family members to understand what the patient is trying to say. Sometimes the patient may also feel frustrated when he is not able to communicate properly. In such cases, a speech therapist helps the patient by checking his condition and then designing a specific program of exercises and therapies that would help him communicate with the society. So speech and language therapist also very important in the rehabilitation team. So next member from rehabilitation team is a rehabilitation nurse. So who deal with the rehabilitation patients are trained to take care of the everyday need of the patients. Often after severe brain or physical injury, a person may find it difficult to take care of oneself. So these nurses are trained to take care of patients. That is the purpose rehabilitation nurses in rehabilitation team. So rehabilitation nurse provides continuous nursing care and patient education. So next, clinical psychologist. A clinical psychologist is an important member of the rehabilitation team. Rehabilitation is not only about physical recovery but also about emotional, behavioral and cognitive recovery. After injury or illness, patient may experience depression, fear, loss of confidence and cognitive difficulties, adjustment problem. The clinical psychologist helps the patient cope mentally and emotionally. So next we are going to see social worker in rehabilitation team. A social worker is an essential member of the rehabilitation team. Rehabilitation is not only about medical treatment, it is also involves social adjustment, financial support, family adaptation and community reintegration. The social worker helps the patient and family manage social, economic and environmental challenges. The social worker evaluates the family backgrounds, financial condition, living environment, employment status, social support system, cultural beliefs. So this helps in planning realistic rehabilitation goals. So next we will see role of prosthetist and orthotist in rehabilitation team. Prosthetist and orthotist are key members of the rehabilitation team. They specialize in designing, fabricating and fitting artificial limbs and supportive devices that help in patients regain mobility and functional independence. Prosthetist deals with artificial limb replacement. Orthotist deals with supportive or corrective devices. Both professionals work closely with doctors, physiotherapists, occupational therapists and other team members. So next we are going to see vocational counselor in rehabilitation team. A vocational counselor is an important member of the rehabilitation team. Rehabilitation is not complete unless the patient becomes economically independent. After injury, illness or disability, many patients may lose their job or face difficulty returning to work. The vocational counselor helps the patient to identify suitable employment, to develop job skills, achieve financial independence and also reintegration into the workforce. So vocational counselor also very important in rehabilitation team. So next, nutrition. So nutrition plays a vital role in the rehabilitation process. After injury, surgery, stroke, spinal cord injury and chronic illness, the body requires proper nutrition for tissue healing, muscle strength and recovery, immunosupport, energy maintenance, prevention of complications. So a nutritionist ensures that the patient receives a balanced and therapeutic diet suited to their medical condition. So next we are going to see role of family in rehabilitation. Rehabilitation is not successful with medical treatment alone. Family plays a crucial role in the recovery process. After illness, injury, stroke, spinal cord injury, amputation or chronic disease, the patient depends heavily on family members for emotional, physical and social support. Family involvement improves treatment outcomes and quality of life. Family is the backbone of rehabilitation. Medical treatment restores the function, but family support restores confidence, dignity and independence. Successful rehabilitation depends not only on healthcare professionals but also on active family involvement. So next we are going to see responsibilities of the rehabilitation team. A rehabilitation team consists of healthcare professionals who work together to restore a patient's physical, psychological, social and vocational abilities after illness, injury or disability. Their responsibilities are shared and coordinated to achieve maximum functional recovery. The major responsibilities of rehabilitation team that are comprehensive assessment, goal setting, individualized rehabilitation plan, documentation and progress monitoring, patient-centered care, ethical practice, communication among team members, discharge planning and follow-up. So finally we are going to see importance of teamwork in rehabilitation. So teamwork provides the holistic care, faster recovery, reduced complications, improved quality of life and better functional outcomes and also efficient resource utilization. These are the importance of teamwork in rehabilitation. So finally, rehabilitation is not a single person effort. It is a coordinated and collaborative process that involves a team of dedicated professionals working towards a common goal, restoring patient independence and quality of life. Each member of the rehabilitation team has a unique and important role. However, roles alone are not enough. The true strength of rehabilitation lies in teamwork, communication, shared goals and patient-centered care. Every team member must coordinate, monitor progress, prevent complication, educate the family and work towards holistic recovery. I hope you all are understand the concept of rehabilitation team members and their roles and responsibilities in this video. Thank you so much for your listening.